intern year, a few months in, I started to make a comparison that perhaps is not the nicest. But I came to the realization that intern year is akin to high output heart failure. So you start the year as a pump that functions well, without systolic or diastolic dysfunction. But you soon realize that alone, it's very hard to meet the needs that the system requires. A few weeks into intern year, I had an experience on the wards that kind of epitomized this comparison. I was on the medicine yellow team. It was my first wards block, and I admitted a 48-year-old man named Mr. H. He had a history of vascular disease, hypertension, diabetes, ESRD on dialysis, and came in with an episode of pre-syncope. Mr. H had really undergone a transformation the 2 years prior to presenting. He had previously been morbidly obese, weighing around 350 pounds, and had complications of that condition. But over the last 2 years, focusing on diet and exercise, and just with a renewed joy for life, he was able to lose that weight. He had started walking around his nearby lake with his sister and his dog, and just really had found a new joy in life. One day, he was walking with his sister, and all of a sudden became short of breath and lightheaded. He felt like he was about to pass out, though he didn't. And because of the fear surrounding this episode, he presented to Bayview, and I admitted him. My first syncope case, or pre-syncope case of many that I would have this year. Working with Mr. H, I felt like I finally hit my stride. I mean, I started to find a stride 2 weeks into interning. I loved pre-rounding him in the morning and trying to answer his questions. When his echo came back showing some wall motion abnormalities, I discussed the need for catheterization. And each day when I worked with him, he looked well, until the day of the catheterization. When I walked in that morning, I knew that something wasn't quite right. He was tired, he was weak. He wasn't able to describe exactly what was wrong, but he knew that something wasn't quite right. That day, things escalated quickly. He became bradycardic to the 30s. And though his heart rate soon recovered, he then became hypotensive. I called my first rapid response that day. I remember kneeling beside him, holding his hand, saying, "A bunch of people are about to rush into this room. It's gonna get a little scary, but it's because we want to take good care of you. And I promise things are gonna be okay." I soon realized that things were gonna be anything but okay. He was upgraded to the CICU. And later that day, as I drove into the garage of my apartment building, I got a text from my attending that he had in fact arrested and passed. As someone who's interested in palliative care, I thought I was used to death. I thought that I was used to codes in the ICU, transitioning people to hospice, and then having them die. But I hadn't yet experienced this idea of someone who could be so stable one day and then so sick the next. I spent the evening perseverating over everything that had gone on that day and the day before. Was there something I missed? Was there something different I could do? If I had caught something, if I asked him a different question, if I'd done one thing differently, would he be alive? Able to reclaim this life that he had. I didn't know how I was going to go in the next day. I knew that I had been pumping well so far against the demands the system faced, but I thought that with this additional hit, I was certainly going to decompensate. But then the next day happened, and I made it through. And that was not because of my own resilience, certainly, but it was because of the people I was surrounded with. My attendant, one of our chiefs, who took me aside before rounds and watched me devolve into tears and let me know that was okay. Another one of my chiefs who let me reflect on the experience and what it meant to me. One of our second years who had been through a similar death early in her intern year and had understood what that experience meant to me. It's often hard to reflect on intern year. It goes so fast and you're doing so many things at all times. It's hard to understand what it actually means to each one of us. It's a year of undeniable, irrevocable change. But the things I think I'll remember looking back on this year are certainly moments of pain and suffering, but also the moments that joy is able to break through those tunnels. When I think about those moments of joy this year, they're intrinsically linked to the interactions I've had with people. Whether it be talking to a patient about their grandchildren and watching their eyes light up, or working with Dr. Wright to discuss a Frida Kahlo painting with another patient. Whether it's getting to know my co-interns, having one co-intern, I don't know how we did this, but somehow made me come to work an hour early to study because he was invested in my education. Or another co-intern who could read my eyes and volunteered to run first because he could see that I needed an extra minute before starting because of a difficult patient experience. I think of my chiefs, the people who push me to always ask why and push my learning a step further and further. The ones who push me to be a fierce advocate for my patients at all costs and to never lose the never-ending plethora of emotions that I feel, despite how much the system might try to take it away from me. The people who push me to always take a breath when it's needed. The system, so to take a step back, I used to describe intern year like high output heart failure because I didn't understand how you could face all of these, the demands of the system on your own. But as cheesy as it sounds, right, we're never alone here. I'm surrounded by such an amazing group of people with such motivation and passion and perseverance and empathy who are so driven and motivate me each day. And the system asks a lot for us, but there's nowhere else I would rather. Thank you.